in a way, this is just once again what the UK government has been working with. Having special sessions where actually you keep the parents and the tutor and the students together, so engage everybody, right? And discuss with all the goals of the students and the progress they are making in the schools. And the same is in a way true for healthcare. Healthcare is another broad domain for services, at least in societies like the UK. And again, you find that there's a tendency to more engage the patients. As I said before, patients, especially patients who are long-term patients, who have chronic diseases, they tend to be kind of experts on their own type of disease, on their own types of diagnosis and treatments. And so it makes sense to encourage the doctors to consider the patient not so much as somebody that needs to be treated, but as somebody who knows how to treat this type of illness, because it's their illness and they're working on it for years. Right? So the patients are in a way experts and part of the service. And there are obviously situations where there are lots of special information about patients that should be taken into account. And especially if people sometimes visit different medical doctors, it could well be that the medical doctor is not aware of some information that the patient can be aware of, right? Like other medicines or a history of allergies or things like that. So, the government should consider providing generic tools for doctors to use them to focus on the special individual things of the patients. And now to the Dutch situation in the Netherlands, there has been a big effort to create a patient record, which is an electronic record which contains all the information on the individual patients, like the type of illnesses they've got, the type of medicine they have got, the type of treatment, the type of allergies. And interestingly, many Dutch people are now not in favor of that. They think this is a danger to my privacy, and even though the whole system was kind of designed and prepared, it's not yet installed because now the patients or some patients don't like it and shout about it. So we have a balance problem here, right? The people who designed it thought this would help people to have individual treatment. And many people who could be supported the designers thought, tell us now, we don't like all this information to be available in the network. So any medical doctor could look at it, and the pharmacy would look at it, and who knows who else can look at it. I don't like it, they say. Right? So, we have a big problem here. And this is a problem in the Netherlands, not in the UK, but in my country. So, it's politics. And here it says, you have to balance. You have to balance the costs, you have to balance the rules, you have to balance the acceptance of the public, and this is a problem. It's not solved. And in a way, I see it in my own country. Very recently, like last week, there was a discussion in the press about how to accept this private data in the patient's files. Right? Should we make it available for the whole medical domain, so that all physicians that are treating you and all pharmacists can look at your records, and then we get this kind of discussions. So, and this is politics, right? So you shouldn't think that you can just solve it by your design, but you should be aware. You should be aware that if you design something, you will find out that some people have very strong feelings in favor of one or the other solution. So, this is just an example. We have talked about the public services in the UK, and well, you can look at it from the point of view of the Italian situation, and some of you might have been looking at what Obama was trying to do in the US in his attempt to reform the healthcare. You are aware Obama tried to reform healthcare, and he failed. He didn't get what he wanted. In the US, many people, you could say most of the people that vote, are against healthcare facilities for everybody, which is kind of strange from my point of view. In the Netherlands, at least, people say we are all in favor of healthcare for everybody. In the US, the majority says we are against enforced healthcare for everybody. Right? And Obama tried to solve it in a way different from the British, and he failed. He didn't get political support. So, it's politics. So what's the problem here? So maybe some of you would like to reflect on the Italian situation on healthcare, which is unknown to me. So what's the situation? We have some very strong notions from the UK healthcare situation, which is very much pushed by the government, and which looks a lot like the Dutch, although the Dutch now recently, so the Netherlands recently got a problem in this patient files. What's the situation in Italy? Is healthcare available for everybody?
Yeah.
Does the government want this?
Yeah.
Yeah. Are there problems, issues? What kind of problems are there? Corruption. Yeah.
Illegal immigrants also. Illegal immigrants.
Illegal immigrants, yeah? Okay, are they, do they have access to healthcare?
The doctors are obliged to take care of them.
The doctors should help?
No, are obliged.
Are obliged?
Yeah,
okay,
but the law doesn't say the same thing.
Interesting. In the Netherlands we have lots of illegal immigrants as well, and doctors in the Netherlands are obliged to help, and if the people cannot pay, the doctors should still help, and the doctors are not allowed to provide information to the police, for instance, by law. And still there's problems, because especially in Amsterdam, where we have lots of illegal people, clinics sometimes spend a lot of money to help these people, and there's no way for them to get the money, because the government doesn't provide the money for this. Interestingly, right? So you can see here, there's a problem of the official goal to provide facilities for everybody, and even the official goal to not hinder people to get facilities because of their legal status. If the police should catch them and put them in prison, the doctors should not tell, in order to make sure people get their treatment, and the doctors don't get any money for that. And in a town like Amsterdam, this is a big problem, because this is a lot of effort, a lot of care from the clinics that's not paid for. So they have to, well, find the money in a way that nobody is telling them how to find. So are you aware of the situation in the US? Where if you don't have money, you have no health care? Just no, zero. And doctors are not allowed to help you because they are liable. If something fails, if a doctor treats somebody and it fails, then he can be brought to court because he didn't help you in the official way. Right? And you know that the American politics are against public health care for everybody in a way that's not understandable for me, but I'm not saying this is bad, it's another political value, different ways of values, different culture. Okay. So, next time, 2 weeks from now, we will talk about culture and about cultural values. Because we have to be aware of that. We can design things and then find out that people are not going to use it. Because it's against their values, right? So,